Franciscan Digestive Care Associates, Bonney Lake, and Franciscan Endoscopy Center, Bonney Lake.
All right.
Awesome. This is Sherry Evanson. She's one of my RNs on the procedure side. Also on our team this week was Deb Watts, scheduling supervisor, Vicki Holman, nurse supervisor on the clinic side, and Audrey Pastor, who's one of our endotechs in procedures and the cleaning room, and thank you to those on the team. We also had the privilege of having Scott Beck from ITFMG on our team as well, and Daryl Turner, so thank you. So, once our patients check in downstairs at the intake area, they'll come up to the third floor, come off of the elevators, and enter into our combined suite. So we have this entire area right here. When they come in, they're going to come into the reception desk area, and if they are a clinic patient, they will be sent to one of the 5 exam rooms in the clinic area. I'm just going to show you briefly that we separate along this line, so that is the clinic area. So, yep. So they have 5 exam rooms along the perimeter, all of barn door entrances. The patients will come in to see either the GI physician or the mid-level provider for a consult or office visit. They'll be greeted by the nurse who does their intake, see the provider, and then the nurse will either schedule them for procedures, follow up with their medications, or whatever else needs to be done during their visit. Their nurse's station is centrally located here. And they also have a flex room that can be an education room for patients and family members, or it serves as a consult room for provider to provider or staff evaluations. They have a toilet here for patients, and they also have an open dictation area suitable for 2 providers to work in at one time. So now the endoscopy patient comes upstairs, and they also come into the same reception desk. They will come in and be sent into this sub-waiting room. That's primarily, we have to have a little bit of waiting room there, only because we're on a fixed schedule, and sometimes things get a little bit behind, backed up back here. So we have to have some place for them to temporarily wait until we can get them into a bed in the back. It's also a place for the family members to wait for them while they're here. We also noticed that on the back of the building here, there's a nice alcove, which we're hoping they'll put benches, chairs, something out there for them to wait in the nice natural daylight. So entering into our suite, we have a patient bathroom here. Colonoscopy patients have to get the rest of that prep out. That's just part of the process here. And then what we've planned is a recliner area for them to be admitted in. There's no reason for them to be in a bed if they don't have to right off the bat. So just a curtained off area for them. They can actually change in the restroom if they like, or it'll be privacy curtains so they can change behind the curtains, plenty of room for them. They'll do their intake process there, get their IVs placed, get all their health history, and be ready for the procedure. At that point, when the procedure room staff is ready for them, they'll come and walk them into the procedure room. They'll have a stretcher already in there and ready to go. And then they'll come in and have their nice procedure. And what you can't see over here is Dr. Carroll doing his colonoscopy.
And there's Sid right there.
No, that's a violation. So this is our endoscopy suite. We're set up with the ability to do all EGDs and colonoscopies in here, not planning to do liver biopsies or any of the therapeutic procedures that they would do in the hospital. Once the patients have their procedure done, they'll come out to one of the 4 recovery bays on the outside here. So we see patients every half an hour, and if everything's moving fine, we shouldn't have any backup at all, and this room will be empty. Okay? Once the patient comes out to recovery room, the physician will come out to the dictation room. They actually have just an open concept room with a table and their computers looking outside. That would then glare on their computer screens, and they'll do their dictation, come back in and do procedure, finish this procedure, come and discharge this patient, do their dictation, and keep it the same cycle. Very short distance for them to have to go. We did build a consult room here, just in case that a diagnosis needs to be talked to with a family member in private, so and patient also. This is our reprocessing room, so there's an interior door between the procedure room and the processing room. The tech comes in, gets a scope, takes it in, and we have a dirty to clean flow with storage scopes on this side, so it's really nice and efficient, and they get a great view of the outside while they're cleaning the scopes.
That's rare, isn't it?
It is. Makes a happy job for them. So in our workspace, we have a centrally located nurses station with the ability for them to look out onto their patients at all times. Our blanket warmer and our clean storage area. We also have a second patient toilet because heaven forbid somebody's doing enemas and the other bathroom's tied up, or the bathroom's tied up and somebody else needs it. We have our soiled utility room, and then we did have enough room to put in a shared office. That could be for a manager that comes on site, a physician that's got admin time that they need to do work other than in the 2 dictation rooms in the suite. So it'll be a multi-person room. And then coming into this area, we have a staff area. We've got our own staff toilet in here with a shower, which is a requirement for a hospital licensed endo suite. And then we have a lounge area with a locker and table, because it's not real easy for us to take our quick breaks in this area right next door, believe it or not. So.
As a recovery nurse, you can't leave your sedated patients. Your procedure nurse, you can't, really leave. So this is a quick place. It will be nice to be able to have lunch out here.
On this design, they originally actually wanted 2 endoscopy suites in this space, and it's not practical for us to get it here. There's just not enough square footage to put 2. We had the option of moving the clinic down into the multi-specialty center on the 2nd floor. But since this is going to work for our population right now.
And there's more convenience, there's some flexibility.
There's some space next door that we'd love to have.